Welcome to Counseling Conversations.
We are your hosts, Kyle, Carmel, and Christine.
This podcast is brought to you by the Illinois Counseling Association.
Good morning, everyone. Welcome to Counseling Conversations with Carmel, Christine, and Kyle. Today, we have some very special guests here from the Association of Counseling, Sexology, and Sexual Wellness, Dr. Frances McClain and Lisa Salvadore. Welcome.
Good morning. Thank you.
Thank you for having us.
Good morning.
Thank you for being here.
Good morning. Yes.
Why don't you tell us a little bit about yourselves?
Well, I have been in the counseling field for many, many years. In fact, I became a counselor before there was even licensure in Illinois. Worked many years, over 25 years in community mental health. And before I joined academia, I was a director at the Joslin Center up on the North Shore. But I did a lot of hospital linkage, program development, supervision, and a lot of work out in the field, case management. And then I decided to join academia. About 14 years ago, I'm at the Chicago School and decided to start my PhD and sat for my dissertation, defended my dissertation at 59 years old during the pandemic, and did that on white anti-racism. And have been an active, I'm a co-founder of the Association of Counseling, Sexology, and Sexual Wellness, which I hope we'll get into later, which has been a very exciting chapter in my life. So to anybody out there, you know, you can do very interesting things all across the span of your career. So it's a little bit about me, Lisa.
Hi, I'm Lisa Salvadore. I'm an LCSW, I'm an LCPC, and I'm a certified alcohol and other drug counselor. That's just all the credential stuff. Currently, I'm full-time faculty at the Jane Addams College of Social Work. I also adjunct at the Chicago School of Professional Psychology. I've been doing that for, I don't know, maybe about 12 years now. I too spent about 16 years in community mental health, working with individuals that were severely mentally ill, substance abusers, and involved in the criminal justice system. I worked with, actually in DuPage County, which we developed the first mental health court. So I worked with mental health court, worked a little bit with drug court, and I do a little bit of private practice. I don't do community mental health. I'm also, like I said, kind of in academia, not kind of, I am in academia now. So private practice, academia.
She was NAMI's Advocate of the Year in DuPage many years
ago. A while ago.
Yeah.
Impressive.
Thank you.
Thank you for those wonderful introductions, ladies. That makes me even more excited about today's interview. How about you guys, Christine and Kyle?
Yes, just hearing about the wealth of their experience, I'm excited. I'm a little bit giddy over here because I want to know so much more.
Yeah.
Old timers.
Yeah.
We love that. That means experience.
Yeah.
Wisdom.
Mhm.
For sure.
We've been around for a while.
Yeah.
Yeah. Well, let's just jump right in. I'd like to know first and foremost, just how you became to be the co-founder of the Association of Counseling, Sexology, and Sexual Wellness.
Well, this is also an interesting story. Lisa and I both were teaching at the Chicago School, and one of the faculty there retired that was teaching the human sexuality course and asked if I was interested. And I was like, oh, yeah, absolutely. I'd be fascinated doing that. And Lisa and I are also married and have been together 29 years this year. Yeah. And so we thought it would be really interesting if we co-taught human sexuality, and saw how that went. And we've been now co-teaching it 10 years.
Over 10 years, yeah.
And the students really enjoy it. And I think the fact that we're a couple teaching it, we're a queer couple teaching it, and we also are very different. We're opposites attract without any question at all. I often tell the students the only reason they let me teach human sexuality is because she supervises me. And it really has been a lot of fun. And we say the reason our relationship works is we have shared values. We're very, very different, but we have very shared values. And so we've enjoyed it. But early on, I reached out to Dr. Robert Zaglin, who has written several articles and had written several articles on sexuality. And we used one of his articles. And we were in communication. And there was an ACES conference in Chicago in 2017. And I went to one of his sessions and we started talking about why isn't there a division on human sexuality? There's SAGE, which focuses on, right, LGBTQ plus community, but not the overarching human sexuality. And so I started gathering names and contact information on people in that conference. And afterwards, I reached out to Angie Schubert, who is a moderator of SWIC, which was a sexual wellness and counseling network in ICA, to see if she was interested, and she jumped right on it. And that was the beginning of 2018. We started the dialogue about putting together a division in ACA. And really, I talked later to people who were scholars in sexuality, which I don't really consider myself moving in that direction, who said, we've been trying to push this for a long time. How did you guys push this through? And it really was, we didn't know any better. We didn't know we couldn't. So we started doing it. And by the ACA conference 2018, ACA had graciously allowed us a space, and we had been getting the word out, and it was a packed room. And by then we had set up officers. Robert Zaglin was honorary past president. Angie was the president. I was the president-elect. And it was packed. And, I think Angie, Robert, and I were the three co-founders, and we had all our superpowers. But I think our timing was just phenomenal. People were desperate to really think, talk, and learn about this. Our timing was really, really very good. And we have now over 1,000 members. We do webinars since 2021.
Probably at least. Yeah.
We partnered with the Chicago School, and we offered at that time free webinars for members. Now it's $10. We were doing monthly webinars. It's grown astronomically. And then, of course, this past September, we became a division of ACA, which it's been an incredible journey. But that kind of tells you what it's been. But it's been hours and hours of work and just incredible dedication. But it's been passion as well. So that tells you the history.
Wow. Yes, that was just I'm amazed about the things you've done along this journey to establish this foundation. Would you tell us more about what the association does and its mission and its values?
Yeah, at the core of it, it's about education, educating mental health professionals, obviously targeting counselors. But one of the things is there are no other professional psychologists don't have a human sexuality division. Social workers don't. We are the only now mental health profession that has a division solely focused on human sexuality. And when we started out, people are like, well, we have SAGE. Why do we need human sexuality? And I'm like, the answer's in the question. Right? Because sexuality isn't just about, right, the sexual minority, the marginalized communities. It's everybody. Right? It relates to everybody across the lifespan, and it's really critical. So it's about educating, right? And we're about research and scholarship, and we're about advocacy. And I think we've certainly seen currently where the way things are that it's really critical. And I believe as a counselor, we need to be social justice warriors. I tell my students that all the time. We have to be social justice warriors. It's not just in the room when you're meeting with your clients in that space. We have to be advocates for mental health in our community at large. That's our responsibility. So that's a big part of what we do with AXWA as well. So those are kind of the cornerstones of what we do.
Yeah. Thank you for making that comparison between what you guys do and what ISAGE does, because that was another question that I had. So thank you for that.
In fact, Sage has been one of our greatest champions, just to let you know. There's a lot of overlap, but there's a lot of overlap with the other divisions as well, right? But Sage has been a great supporter of what we do. And, they saw right away that there's a need for a human sexuality division.
Great.
That's wonderful. I love that you're championing the advocacy. It's not just in the room. I'm totally with you on that. I say that all the time. It's not just what you do in the room.
Warriors.
I love it.
Yeah.
I love it. So how does someone become a member of it? And what are some of the benefits maybe of being a member?
Couldn't be easier. www.counseling.sexology.com. www.counseling.sexology.com. And you could go on there and sign up. Right now it's free. I imagine now that we're a division, there may be a membership fee. We'll probably keep it fairly low. But the truth is that those of us who are co-founders have been financing the website and everything. It's been out of pocket for the last, since 2018.
Since 2018.
So we'd like to be able to have some membership fee, but right now it's free. So just go onto the website, sign up, and with it, like we have the webinars and we do low cost for members. We have the regular members. I'm the editor of the newsletter that comes out quarterly, and in the newsletter we have articles, we have regular information related to sexuality, right? We have the website, we have information on the website. So we have a lot of different things we have different committees that people are involved in. We just published, and we have the journal. We have a journal on sexuality and sexual wellness, which is free. And we just published the exemplary practices in counseling. So I would certainly recommend all of you check that out. You can link into the journal on the website. Our research and scholarship committee put together the exemplary practices, which are phenomenal. They did it according to the multicultural practices, and it really is incredibly thorough and really amazing. Dr. Patricia Arredondo is one of our trustees. The board of directors, I was still on the board at the time, we endorsed the exemplary practices, so we're really trying to promote that now as well. So
awesome. I'm on your site right now.
I
was looking to see how you could become a member. I'm like, free? I'm going to sign up right now.
Yeah. Oh, yeah. Come on board. Absolutely. We just did a special issue of the newsletter, which talks about our becoming a division, the journal, and the exemplary practices. So, yeah. That's awesome. My creative outlet is doing the website and the newsletter.
So I have a question, Dr. Friend. Is as one of the founding members of the ACSSW and the former president of the division, I've with the question, have you all established a BIPOC task force specifically for sexual education?
When I was president, that was my platform. I really wanted to focus on really looking at BIPOC communities and being able to look at what were the needs in terms of research, as well as how I felt like it was important, and this, not just me, right? The entire AXWA leadership, we didn't want to whitewash sexuality. The experience of sexuality is not the same across all race ethnicities, right? And I think that it's really critical that we acknowledge that being able to develop a healthy sexual identity when you experience oppression it's much more challenging and much more difficult, and it's different, right? And that we need to acknowledge that. And my dissertation, as I mentioned, multiculturalism is second to sexuality, right, is really critical for me. And I went to Dr. Arredondo, who's my mentor, and I said to her, as a white person, is it appropriate for me to make this my platform and move forward? She said, absolutely, go for it. Use your privilege. So that's what I did. I put together a BIPOC task force with a phenomenal group of people. I was so happy to be able to put together these really strong people within the counseling community. Dr. Arredondo was one of the people involved with that. Dr. James Wadley, Dr. Stacy Lightham, some other people. I made sure that we had clinicians as well as some students involved with it. And they were tasked with looking at what's the current literature. Now, the literature in sexuality, there is not a lot, period. And then that much less in relation to Black and brown people, right? And the idea was trying to look at what is the literature out there, what are the needs for the different communities of color, and as AXWA, how can we better serve those communities, and what can we do in terms of that? And then the task force came back and said, what you need is a ongoing BIPOC community. That's one of the things you need to do. We only started to do work in this area. So then the decision was to have an ongoing BIPOC committee, which is what we've done. And really, the idea is continuing to work with that around encouraging more research and literature and education around these issues, and making sure that counselors are better educated and better able to shore up these communities specifically around areas of sexuality.
Ladies, I'd like to know a little more about your inspiration for being so passionate about that BIPOC community and the BIPOC task force. I'm wondering if you happened to have some experiences with maybe some individual students or clients and within that community that maybe didn't feel supported, weren't able to get connected, or didn't necessarily have the resources or a voice to kind of back them up with regards to sexuality.
I think just, and Fran can probably talk to this much more, but I think just across the board, when it comes to issues relating to sexuality, many people struggle with getting connected for a lot of different reasons. Shame, society's views. So it only is magnified within the BIPOC community. So that was definitely part of some of the thinking.
And plus, when you talk about the field, it's a white field, and I think that it's really challenging when you talk about Black and brown folks connecting with clinicians that look like them, right? I think that's a challenge, and having an understanding. And some of it was having people of color come to me at conferences after we've had our meetings and saying, are y'all looking at this? Because this is an area that needs to be looked at, right? And this it can't just be just from a white perspective. We really need to dig down and be sensitive to that, right? And it's also sitting with clients that I've had, right? As a white person, and with our students talking about issues related to the LGBTQ plus community, I had a student, a Black woman, talking about how it's different when you talk about the LGBTQ plus community. And she said, I have a Black son, and I'm concerned about him being a Black man. And if he comes to me and says that he's queer, that's that much more that he's challenged with. And so that's different, right? And I think that having that sensitivity and understanding and really appreciating the layers of oppression, right? We talk about minority stress and really looking at that. So I think clinicians really have to have an appreciation and understanding of all the different levels of oppression, intersectionality, certainly. And I think that's critical. I think we need to shore up and support our students, our Black and brown students, because it really is critical to have therapists of color out there. That's really important. But they also have to be trained and understand about sexuality as well, right?
Certainly. Thank you for that. I figured as much that there were some experiences and some history there.
Yeah.
I too, as a clinician, have encountered a variety of circumstances and situations with clients who have struggled with having the support and the resources and just feeling like they have a voice. So thank you.
Well, and this is so inspirational that you created a whole division under the ACA. How can other organizations learn from you and maybe expand their reach as well?
I think if you have an area that you are really passionate about, I think I'm sitting here today. This is not anything I anticipated doing, right? It's not like, Dr. Ardonda called me a mover and shaker a little while ago, and I'm like, are you serious? I was incredibly passionate. I was willing to invest an incredible amount of time about something. I made sure I connected with some really good people. Robert and Angie were phenomenal. And like I said, the timing was really good. But if you're committed to something and you think that something's important, you just keep pushing and you keep pushing. And networking, I tell students all the time, one of the most critical things in our field is networking and reaching out. I networked to Robert, who was in Texas, because I liked his article. You really, in this field, one of the most critical things is reaching out and connecting with other people who share your passion, right? And it does, and we're in a global world, right? You can reach out to people wherever you are. And if you think something's important, you keep going, you keep going. And if you believe in something that's important, I have a whole new thing. My new thing is supervision. I think we should have to have supervision after we're licensed. I just want to plug that while we're sitting here. That's my new passion. I'm going on it. We don't police ourselves better. But if you've got something, and I'm an old lady, I'm 63 years old, I'm not done yet. So you just do it and you connect with other people. I love this field. I love what we do. I think there's great opportunities, and I think you can get things done.
I love that. And I'm with you on the supervision thing.
Yeah, that's my next one.
I second
Let
that.
me know.
I enjoy supervision, especially as a clinician. I'm able to go to someone who may have much more of a wealth of experience than myself and just sit underneath their wisdom and absorb it and receive some type of like structure or guidance in working with clients. So that is amazing.
Yeah.
With that being said, I have a quick question. Why is sexology and sexual wellness important to integrate into the field of counseling and psychology?
That's a cornerstone, right?
Yeah.
Sexuality is an essential part of the human experience. It just is.
And through the lifespan, as you mentioned earlier.
Yeah. And it's important to everybody, right? Even if you're asexual, you still have body parts that you need to check in on, right? For everybody, it's a part of who we are. It's around us everywhere. And certainly our society has a distorted and unhealthy relationship with sex and sexuality. We don't get good sex education. Nobody. And as clinicians, we are not well educated. It is not, there's two states, California, Florida, believe it or not, that make it a core part of the licensure. That's hard to believe. It's an elective in almost all the counseling programs, which is really difficult to understand. Every one of our students that take our course say, we can't believe that this isn't a core course. It is critical. It's critical. What the research shows us is that sexual issues are an issue for clients. They don't bring it up because they're afraid of judgment. They're afraid that the counselors are going to be able to talk about it. And what we also know is that clinicians who aren't trained, and we know they aren't, are afraid to talk about it because they're uncomfortable. So it's really something that we need to get out there. We need to educate because it is a part of people's lives, and we know that they want to talk about it and need to talk about it. It's an overarching issue.
It certainly is. What do you think, ladies, are the most common challenges that clinicians face when working with clients who are dealing with any issue or problem related to sexual wellness or sexuality?
So as Fran just really talked about is number one, people are very hesitant to bring it up. And what we have found basically through research and our own experiences, people will come to you with other issues, anxiety, depression, just discomforts in a variety of ways. And unless we ask about it very specifically, and just open that door, that doesn't mean the client has to say anything or reveal anything at that moment. That door's been opened. And later on, they know it is okay to come back and revisit that. And I think it's on us to, check in with them about that very same thing at some point in the future. So we don't, you know, as a profession, as Fran said, research shows we don't ask. And if we're not asking the questions, then we are not, you know, we're not treating the whole person. And that's what we need to be doing. We also know recently somebody told us, you know, their relationship was having some issues. They went to a couples counselor, and not once did the couples counselor inquire or ask about intimacy or their sexual relationship. They were just working on just like the conflict stuff. So, and that was a big piece of what was going on in their relationship as well. I mean, it's not the only thing, but there's a lot of things. So just asking questions, we have to do it. We have to create space that people can ask, that they feel safe, whether it's today or whether it's 4 months from now. We lack training, as we've already talked about. Fran already talked about just this weird relationship that our society has with sexuality. We sexualize everything, but we don't talk about it. It's not okay to talk about it. Um, and I think for counselors also, and maybe we'll get into this in a little bit, is really being able to tease out what is dysfunction and what is distress, right? Many people have distress around sexual issues, their identity, things like that. And then there's dysfunction, which is sort of a separate category that I feel like is something where, you know, you really need to refer out.
That was a beautiful answer. So thank you for that. And I just want to say before Kyle and Christine jump in that when we see the word or topic sexuality or sexual wellness, people automatically think that it means something related to the LGBTQ population.
Yes.
And I just have to say, this is a huge issue for all human beings,
Yes. Amen.
regardless of your sexual orientation or preference or
Right.
gender. So I just had to say that.
Thank you.
You're
Yeah,
welcome.
we really try to think about it, and we talk to students about just normalizing conversations about it, and that it's okay. And like I said, just introducing the topic to a client, and if they, you know, if they feel like they want to move in that direction, great. If not, you save it for another time.
Yeah,
Certainly.
and I think that this like distorted connection to sexuality and sexual wellness begins at home from childhood to
Yes.
adulthood,
Yeah.
and that's what makes it extremely uncomfortable to enter into the space and say, hey, this is what I'm struggling with, and due to the shame
Yeah.
that's behind it for sure.
Yeah.
Yeah.
Yeah. I worked with a middle-aged woman who was going through a divorce. This is many years ago. And, you know, she was older. She was going through a divorce. She had never had a good sense of herself in terms of her sexual identity. And we worked on that. And we talked about it openly, right? In terms of her sexual identity or sexual self. And and this is one of my favorites. She called me up one day and she had left me a message. She had begun dating again, and they had started to be sexual. And she's like, he kissed my butt. And she was so excited that he had kissed her butt, because that for her was going out there. And the fact, because her body image was so poor, the fact that she allowed that to happen. But that's the kind of work that I do. And this is a woman outside, like you say, outside the LGBTQIA, right? And but for her, that was empowering, right? In terms of her sexual identity and her body image and how she felt about herself. And I want to talk about celebrating sexuality, whatever your values and beliefs are. You know, we've had students in our class of every religion. I'm talking every religion. Evangelical, conservative Jewish, Muslim, Satanist, atheist, Mormon, like really every religion. And we talk about whatever your belief system and this is about our ethics. Our field does not dictate what your values are. It cannot. We cannot impose our values on our clients. But within that, this is the sex positive attitude. You celebrate sexuality, right?
Certainly, certainly. There's a lot. I work with a lot of couples in my practice, and it's alarming when you really look at the number of married couples who have one or both individuals who had these messages from very young that sexuality or sex in general was this dirty, horrible thing, and sometimes due to religious beliefs and such, but sometimes just due to their parents' lack of education and information on this topic. And it truly does negatively impact the health of a marriage. And so couples need to learn about this. And so I'm really grateful to have you ladies with us today.
Yeah, Carmel, and I also want to add too, I think it's very gendered. So I worked with a couple and they wanted to increase their intimacy and their sexual life. And in working with the woman, it was a hetero couple. I said, we talked about a lot of different things, and I'm like, if you all have time, they had children, so sometimes sex has to be scheduled, right? That spontaneity cannot always exist. And I said, maybe during the day, send him a little flirty text or something. I said, if you're comfortable with pictures, great, but it just something she's like, can I do that? Of course you can. Of course you can.
Yeah.
I love that.
Needing
Yes.
permission.
Right.
Yes.
Yeah.
And in her mind, that wasn't something, that a quote unquote, good wife or good girl should do. But she got past that and it helped.
Yeah.
Yep. Yep. Absolutely. Makes the marriage healthier.
And fun.
Yeah.
And
Yes.
fun.
Yeah.
Yeah.
And I'm thinking from a clinician perspective, if clinicians are not maybe formally trained, or they themselves maybe have not explored their own sexual identity and feel uncomfortable bringing it up, what would be some advice or training, suggestions, or what sort of suggestions would you give those clinicians?
Well, I would also say to try to educate themselves in whatever ways possible. There are, conferences, things like that, for sure.
Actual webinars.
Right, actual webinars. And, I think there's a misconception that to deal with sexuality or to work with clients around sexual issues, that you have to be, AASECT certified sex therapist, which is not the case. We love them. We need those folks. But most people come in with, and I just like to use that umbrella term of distress related to whether it's identity, whether it's performance, whether it's related to anxiety, things like that. We are trained counselors. We have skills to help people manage those things. The other thing is helping them with resources, with other
Bibliotherapy, a lot of it is.
Right. Providing some general education, maybe around anatomy, around pleasure, around desire, around the difference between spontaneous desire and responsive desire, things like that, that people just feel like this isn't how it used to be, what's going wrong here? It's creating anxiety. It's causing problems in my relationship. It's even if I'm not in a relationship, I'm out there trying to date and it's creating issues for me in that aspect. So I think as counselors, we have far more skills than we realize. And that we can address many, many issues. Like I said earlier, right? When we cross that into dysfunction, that's a little bit more of a very fine issue that now we might need to make some medical referrals, or that's a very appropriate referral to a certified sex therapist. But I'm just so anxious. I don't like the way my body is. as Fran was talking about her client, just, body image issues, self-concept, things like that. We're counselors. We can do that.
Yeah.
Mm-hmm.
So much of what we do, it's about education and normalizing.
Yeah.
Right. A lot of our clients come in and they talk about stuff that they feel is deviant that isn't deviant. Right. And we can say to them, and we try to stay away from talking about what's normal. Lisa and I have really, we talk about it's common versus what's normal, right? Who's to determine what's normal, right? But a lot of it is just reassuring I talk often about, I worked with a man who was in, the police field, and he was in his 30s and had not had a sexual experience. And obviously, that's a highly masculine environment. And, through the course of our work together, identifying that he was on the asexual spectrum and being able to help him come to terms with that and talk about that was incredibly empowering. And that is, being able to help him work through that. You can imagine, as a man in a highly masculine field, those are the things that we can do as counselors. I'm not a certified sex therapist, right? But having that knowledge and being able to work with him. But that also goes to, for clinicians, you have to work through your bias, right? If you have a bias about men, right? And that men, you know, you have to know that all men aren't highly sexual, right? That there are some men who, believe it or not, right? And having knowledge about asexuality is really critical. And for him, it was very empowering. And after our work, he was in a relationship with a woman. They were, able to, be very romantic. He liked the cuddling. He liked being in relationship, but not sexual. So those are some of the things. Those are just examples where you can be very powerful, but not be a certified sex therapist, differentiating distress and dysfunction, right?
Yeah.
That's really helpful. Thank you.
Yeah, it is. As I'm listening to you, I'm thinking about the lack of training that I have as a clinician
Yeah.
in regards to
Me
working
too.
with clients
Me too, Kyle.
about
Me
this
too.
topic.
Yeah.
So I may need to sign up for some new seminars coming up soon for sure.
Take our class, Kyle.
Okay, yes, I'll
We
look it
love
up.
we love our class. Students talk about it being transformative.
Hmm.
And we love it. It's a favorite class we teach. It's really fun.
Yeah, we really get into helping them really think about what they've been taught, what is societal's views about sex. And as Fran mentioned before, we all have our views, we all have our values, we have bias, but that doesn't mean that we put that on the client.
Helping them separate their values from their clients.
Right. And not pathologizing certain aspects of sexuality is really kind of foundational too.
Yeah.
So we talk a lot about that.
Kink.
That's very important because I think about the issues in regard to like the systemic issues in regards to sexuality and how like Americanized systemic issues also contributes to our distorted view and relationship with sexuality as well. And also traumatic experiences, right?
Yes.
And then how do we approach working with clients whom has experienced some form of sexual trauma? Yeah.
Absolutely.
So how do we approach that sensitive topic within counseling or therapy?
I think it's really critical. I think, it reminds me of years ago when we started talking about people who are duly diagnosed with substance use. And I'm like, oh, I don't want to do that because I don't want to work with substance use. And it's like, now we know, of course, upwards of 80% of people, if they're not directly involved, right, or impacted by substance use, it's indirect. The same is true for trauma, right? And in fact, we all just lived through the pandemic. So I think we've all been impacted by trauma in some form, right? And I think the same is true, the Me Too movement, I think brought it home for all of us, right? How many women, especially, have experienced some form, right? And I think that it's much greater than we imagine. And I think there's a lot of work, and I think it's really important. And this is why it's so critical as counselors that we talk about sex and sexuality. And remembering, of course, when we're talking about sexual trauma, we're talking about power and control. That's really important as counselors to understand. I think we have this misconception when we're talking about sexual trauma, it's about sex. It's about power and control, and not losing sight of that. I tell a story. This is my bias against private practice, but I'm going to put it right out there. Can I tell my story?
Sure.
I had hired, when I was director, I hired a lot of part-time clinicians, and I had this person come in. He was a male clinician, came in very well recommended, and my receptionist, the front desk people are very important, came running into my office and said, he's in there with a woman with the lights out, doing therapy. And I'm like, what are you talking about? She said, he's got the lights out. So I pulled him into my office after he met with the client, who I knew was a woman who had a history of sexual abuse. So what were you doing? What were you doing with her in there with the lights out? He said, well, I put the candles on because I wanted to make it, kind of a meditative experience for her.
Little ambiance.
Little ambiance. I said, I don't want you ever to go into a room with a woman, or any client for that matter, who you've never met before, with the lights out and candle, but especially somebody who has a history of sexual trauma and you're a man. Do you not see where this might be problematic? So, but this is a man who has been private. This is the thing with private practice and supervision. Nobody was there to tell him, what are you doing? That's a little kooky. And not only is it kooky, it could cause harm. Are you with me, my friends? So I think you have to always be mindful that anybody walking in your room has sexual trauma, and what that's about, and be very mindful of you and what you come into the room and what you bring, right? But I think some of the most talk about narrative therapy, right? I think is really very powerful when working with people with sexual trauma and rewriting their stories, right? And I think feminist theory is very helpful with that, because it's about power, right? But you can't do it too without being mindful of intersectionality and what other identities they're bringing into the room. And self-reflection. See, it's I have to think about, I'm a chubby middle-aged white lady. Oh, I'm an old white lady now. I have to say old lady. So I have to think about the identities I bring into the room. Like he forgot. He was an older white male with an incredible amount of, right, walking into that room whenever you do any kind of trauma work.
Yeah. I want to speak to the statement that you made about sexual trauma being relative to power and control. And the reason I want to speak to that very briefly is because I have had multiple clients over the years who were in a great deal of emotional distress due to learning that their children had engaged in some exploratory behaviors with their peers and things like that, elementary school age kids. This is actually very common. A lot of parents don't know this, but
Yes.
they come in thinking that this horrible, awful, traumatic thing has occurred to their child. And very often, as I ask questions about the child's emotional and behavioral changes or responses to the event, most often you find that the children have just gone on with, their lives. They're out playing. They want to go back and play with the kids, and things like that. And the parents are like, no, like this horrible thing. And I want to know what your thoughts are, because that's typically what I talk to parents about. And I try to help them to establish whether or not there was a situation or environment in which power and or control has occurred. And most often it has not. And so helping them to manage that emotional distress as, that being a factor.
That's part of the developmental process of kids. And it is very common.
And I think that's why it's so important for the counselor, such as yourself, having that knowledge that developmentally that's very common, but you have to tease out, right?
Yeah.
What happened? Are they all kind of the same peer level? Was it just exploratory? How were people coerced or that kind of thing. But yeah, it's very common, and helping the parent understand, right? Because I think anytime, and because we have such a society that's so unhealthy about it, anytime their child comes near sex, it's like, right? Yeah. But I think, being able to help that parent just understand that this is just kind of, kids do this. And as long as there wasn't force involved, and as long as they were all pretty much in the same age range, that developmentally kids do it, right?
Absolutely.
Yeah.
I took a 40-hour sexual assault victims training through the Illinois Coalition of Sexual Assault many years ago when I first started out my career. So that was very helpful for me.
Yeah. Yeah.
Well, this has been a really awesome and interesting and inspiring conversation. Is there anything else that you would like any listeners to know before we wrap up?
Just check out our website, www.counseling-sexology.com. I think I really appreciate you opening up this platform and allowing us to talk about this. Obviously, we're very passionate about it, but I think it's really critical that counselors, mental health professionals become more educated around this, because I think we're going to be better able to work with our clients, more efficacious. It's really, really critical, right?
And I would just throw in there, to not be scared of talking about it. So many clinicians are concerned that if they bring this topic up, they're going to be offensive or they're going to, frighten somebody. But within the confines of, hopefully you've created a little bit of therapeutic rapport, a safe space. This should really be part of everybody's assessment with clients. Again, just asking some very initial brief questions. And then if people want to follow up with it, or if the clinician wants to follow up with it, to do so.
Open the door.
Yeah.
You don't have to walk through the door, just open that door.
Yeah, I think this conversation, kind of like Dr. Kyle said, has made me really think about how much I'm maybe not talking about it. And because it's like I'm not educated, or I feel like I'm not educated, I can't talk about it in my own sessions. So I've already signed up. So now I am a member.
Yes.
One more member. One more.
Excellent. Thank you.
Christine Barker.
Yay,
I will be
glad to
signing
have
up
you
as
on
well.
board.
Okay.
And I'm
Yeah.
looking forward to doing some trainings, because I think a lot of counselors probably feel similar, that they just don't feel like they have the skills. But I think both of you have normalized that a little bit. Like, no, you do have the skills. We have these assessment skills, distress versus dysfunction. And we have the skills to help with clients about it. It's just opening the door. And I think some basic, like you said, some assessment questions would be great. I know I'm going to start integrating that into my therapy. So thank you both for that. And thank you for being here today. Taking time out of your schedules, your busy schedules, it sounds like, with all that you have going on. It was truly a wonderful experience to chat with you both.
Yeah, we really appreciate the opportunity. Thank you so much.
Nice to meet you all.
Yeah.
Yes,
You
nice
too.
to meet you ladies as well. And I will be signing up too, because like I said, I work with a lot of couples, and I am always talking about sex and sexuality almost every day at work, definitely several times a week for sure. Well, you guys, thanks for listening in today. You have heard another counseling conversation with Christine, Kyle, and Carmel with the Illinois Counseling Association. And thank you, Dr. Frances McClain and Lisa Salvadore with the Association of Sexual Wellness. And hey, guys, you can check them out at www.counselingsexology.com. And we'll see you guys during our next counseling conversation. Thanks for tuning in.
Thank you.
Thank you. Have a beautiful day.
Bye. Bye-bye.